Thank you so much, Jim. It has been more than 6 months since the World Health Organization declared the coronavirus a pandemic, and we are just now starting to understand the long-term effects of this disease. ABC 10 News reporter Jared Aarons went in depth with experts, survivors, and doctors to find out what this disease can do to people even after they have recovered.
There's a lot we simply still don't know about coronavirus because the disease has only been around for a few months. But doctors and patients are working together and just now starting to paint a better picture of the disease's long-term impacts.
I was 45, doing yoga every day and the healthiest I had ever been. And I was one of the first to go down.
Diana Barrett tested positive for coronavirus in March. Like many people dealing with a new disease, she had very little information on what to expect.
The symptoms came and went, and like every day it would be like reaching into a shopping bag and picking out a new set of symptoms.
Even after she recovered, the disease dealt her another surprise.
3 months afterwards, in the middle of the summer, I had a full resurgence of symptoms.
The World Health Organization says typical recovery time is 2 to 3 weeks, but a recent CDC study found 35% of people with mild cases of COVID had not returned to their normal state of health 3 weeks after testing positive. Among people 18 to 34 years old, that number is 26%.
We can expect it, in a lot of cases in people that have been severely ill and hospitalized, but it's concerning that we see it in people that had mild illness and also in young people that didn't have any pre-existing conditions.
The Mayo Clinic, the WHO, and the CDC all say common long COVID symptoms like cough, fatigue, loss of taste and smell, headaches, shortness of breath, joint pain, congestion, and confusion can last for weeks or months. The virus can also cause long-term damage to vital organs.
The bad news is that even after the infection is cured, even after the virus is gone and dead, there's still a lot of ongoing inflammation and scarring that happens in the lungs.
UC San Diego pulmonologist Dr. Amy Bellinghausen says it's similar to other inflammatory diseases.
And just like a scar on your skin, scars in your lungs take a long time to go away.
That inflammation can also affect your heart, leading to problems like myocarditis, which the CDC says might also explain some frequently reported long-term symptoms like shortness of breath, chest pain, and heart palpitations. UC San Diego cardiologist Dr. Eric Adler calls it a new enemy that may be attacking more people than we know.
Given the number of patients that are getting COVID around the country, we just don't know who's having this inflammation of the heart.
The Mayo Clinic also says it's seeing instances of blood clotting and brain issues like seizures and strokes. Bottom line, it's not a disease that just goes away.
What we're seeing are a large group of people who end up with almost like a chronic disease.
That's why Barrett created Survivor Corps, one of many online support groups for people to share their stories of what they call long COVID. Barrett's group teamed up with the Indiana School of Medicine to survey 4,000 recovered patients about their symptoms.
It's great that all of this work is being put into the vaccine, but we also need therapeutics for people who have survived but are mere shadows of their former selves.
UC San Diego has opened a post-COVID clinic to help people deal with their long-term effects, and doctors all over the world are studying other similar inflammatory diseases to try and get an idea of what they can expect over the next few years. Jared Aarons, ABC 10 News.
Experts say the most important thing to do if you are experiencing long-term effects is to stay in touch with your doctor. Now, we have more information about long COVID from the CDC, the WHO, and the Mayo Clinic. Just go to 10news.com.